your back off with some soap, so this kind of feels cold and scratchy. Put the drape over your back, that's what this is. And then they numb the area with lidocaine, and that probably is the worst of it, because it's a needle stick and lidocaine burns, so it feels like a really big bee sting in your back. But once you're numb, you should not feel anything, and if you do, just let them know, and they'll stop and numb you up more. But once they're done, this is all you're left with, is this piece of tubing. There's no needles left in your back, so you can move, you can lay on it. You know, as you saw from the video, your spinal space is here, the epidural space is down here, so they're nowhere near your spinal cord. So there's, you know, I hear a lot of people saying they're scared of being paralyzed. Obviously, we don't want you jumping around the table with a big needle in your back, but there's very little chance of that happening because they're nowhere near your spinal cord when they insert the epidural. So they'll tape, this is in your back, and then they'll tape it up your back, and then attach the end of this catheter to the pump. So it's a pump of medication that you'll have, and they'll program the pump, and that's how you get the epidural medicine. You'll have it for the entire time that you're in labor. We even have the PCA, the patient-controlled analgesia, where you can press a button. So you'll be given a little button, and if you're hurting or starting to hurt more, you can just press the button and it'll deliver more medication. It does have lockouts, so if you press it 10 times, you're not getting medicine that many times. But if you notice you're having to press your button a lot and you're not comfortable, definitely let your nurse know. She can call the nurse anesthetist back or the anesthesiologist back, and they can give you more medicine through this catheter. You don't have to sit up for an epidural again. What else was I gonna say about epidural? Immediate. You'll notice your contractions seem less intense. They seem shorter and shorter and shorter until eventually you don't feel them anymore. Usually within about 20 minutes, you're completely comfortable. And when I say it's gravity driven, so right after the procedure, we'll lay you on your back, obviously with a little tilt so you're not flat on your back. But then after that, we want you to keep moving. So I told you earlier, being upright and movement helps speed up labor. So we're never gonna just let you lay in bed the whole time. So we'll be flipping you from side to side, sitting you up, laying you back. But if you're laying on your right side, all the medicine is gonna go to your right side. So you may start to feel some pain on your left side. So what do? Flip you over, let the medicine go to that side.